We're less than 2 months away from big changes in healthcare. January 1st, 2014, many parts of the Affordable Care Act, also known as Obamacare, will take effect. Greg Young is here to hit some of the highlights. Greg's the Director of Strategic Policy and Initiatives at Medical Mutual of Ohio. Thanks for joining us today.
Thanks for having me.
First of all, how does the new health care law affect Medicare and Medicaid?
Well, let's talk about Medicaid first, because I think that's the most significant in terms of the impact it's going to make. One of the big goals of the Affordable Care Act, obviously, is to cover those who are not covered.
Okay.
The thought was that by having this Medicaid expansion in all 50 states, we were going to cover 15 million people. So, what we're doing is we're expanding it to people making 133% of federal poverty level, which means $14,400 for an individual, $29,300 family of four.
All right. Now, that expansion is up to the state, if I understand correctly, and
that's correct.
Where are we in Ohio? Ohio hasn't yet decided to do that, if I'm remembering correctly.
You're remembering correctly. About half the states have decided to do it. In Ohio, the governor wants to do it, but he's bumped into some political opposition, so it's still up in the air.
Yeah, and I won't ask you your opinion on it. I know my opinion. The Medicaid expansion makes a lot of sense, but we're not there yet in Ohio.
Okay.
Many of our viewers are on Medicare. What can they expect when Obamacare goes into effect?
And that's a great question. The important thing with Medicare for people to realize is that, if they don't do anything, they're going to maintain their existing coverage. But what are the changes? They get the free annual wellness prevention visits and screenings, which are so very important. And also very important is when you look at Medicare Part D or the prescription drugs, there's always been a problem with that donut hole or coverage gap,
right,
where they hit that point where they're paying a lot more. Well, by 2020, that's going to be completely gone. In 2010, it was cut in half. So the Affordable Care Act has certainly helped seniors with that cost.
So right now, we're still in that 50% cut.
Right. Then we have an incremental decrease down to it being closed in 2020.
So eventually, no more donut hole.
Right, absolutely.
Wow, great. All right, so if we don't fall into Medicare or Medicaid, then what?
The Affordable Care Act very carefully defines what acceptable coverage is, and Medicare, Medicaid are certainly acceptable coverage. Employer-sponsored insurance, but how about those people who don't have it? The law is insistent via that tax that they get coverage. Now, if someone doesn't have coverage, they don't get it, they're going to pay a penalty. The good thing for individuals is historically they have not had that comprehensive coverage that people have had in group insurance. With essential health benefits, with the changes that we see, that's going to change.
If you've been denied insurance coverage, maybe because of a pre-existing health condition, tell us how that is impacted?
It's going to be very significantly impacted. We've had, historically, there's been people who've had disabilities, they've had that pre-existing condition, as you mentioned. That goes away in 2014. Also, important to note that, the lifetime limit, say it's $3 million and they have some significant illness and they hit that spend and don't have coverage anymore, that also goes away. So, very important.
So, if we don't have insurance, we can sign up for it. Will we be able to afford it?
It's interesting. I think a lot of people will be surprised to know that the level of subsidies that exist out there to help people purchase coverage, up to 400% of federal poverty level for a family of four, around $90,000.
Wow.
So very significant help purchasing coverage.
Great. Great information. As always, thanks for coming back.
My pleasure. Thank you for having me.
The new year will bring a much-needed shot in the arm to our healthcare system, especially for those who have been without health insurance. To learn more about how you can benefit, use the website that's coming up next. My thanks to Greg Young for giving us the right dose of information.
Learn more about Medical Mutual of Ohio by visiting their website, www.medmutual.com. Next, other ideas can't hold a candle to this craft.